with this global pandemic we've been living through these last 2 years, there's perhaps been no group of workers more essential than nurses and other healthcare workers. And there's also probably no group of workers that have been more stretched to their absolute limit than nurses and healthcare workers. And increasingly, nurses are joining in on this kind of mini strike wave that we're seeing taking place. So, Saint Vincent hospital workers in Massachusetts have been on strike well before Striketober started, and there have been threats of strikes by healthcare workers in many other parts of the country. And the demand that has become most central in many of these fights is not wages or benefits, but safe staffing ratios. Safe staffing ratios would put a mandatory limit on the number of patients that could be assigned per nurse. This would ensure better quality and safer care for patients and would reduce workplace injuries for nurses. Safe staffing ratios could literally be the difference between life or death for patients. And the California Nurses Association conducted a study to determine what kind of impact safe staffing ratios could have on patient safety, and the results were astounding. California is actually the only state with actual legislation mandating safe staffing. And according to the union, saying a seminal study from 2010 on the impact of California's ratios compared California hospitals' post-implementation of the state's minimum nurse-to-patient ratios law to hospitals in New Jersey and Pennsylvania and found, unsurprisingly, that if New Jersey and Pennsylvania matched California's ratios in medical surgical units, then New Jersey would have 13.9% fewer patient deaths, and Pennsylvania 10.6% fewer deaths. Compared to states without ratios, the study found that California RNs reported having more time to spend with patients, and that hospitals are more likely to have enough RNs on staff to provide quality patient care. In fact, the lead investigator of the study reported to the San Francisco Chronicle that, quote, "The differences between California and the other states are striking," said Linda Aiken. Nurses in California take care of 2 fewer patients on average than nurses in Pennsylvania and New Jersey in general surgery. These differences lead to the prevention of literally thousands of deaths. Safe staffing ratios are also in the direct self-interest of nurses and should be viewed as an occupational health and safety issue. Many people may not realize this, but nursing is a very physically demanding job. Just think about all the people nurses take care of who require physical assistance, all the lifting of human bodies that nurses may do on a daily basis. Safe staffing ratios can significantly cut down on workplace injury. So the CNA study went on to say, researchers examined the rates of occupational injury and illness to registered nurses in California before and after the RN staffing ratio law was passed, looking at a range of years from 2000 to 2009. They compared this data to the occupational injury and illness rates for registered nurses in the other 49 states and DC that have not adopted minimal numerical staffing ratio laws. They found that the California RN staffing ratio law was associated with a 31.6% reduction in occupational injuries and illnesses among RNs working in hospitals in California. Now, most often, the fight for safe staffing has taken place among individual unions in their specific contracts with certain employers. But increasingly, nurses unions are fighting for actual legislation at the state level. California, again, is the only state to win safe staffing legislation, and this is the result of an organizing and lobbying campaign done by the CNA.
California Nurses Association really took the lead in fighting for safe staffing.
How we did that as a union together was by having a change in leadership.
All the board members, the presidents, all of the officers were working bedside nurses. They understood the frontline work of the registered nurse. They understood what happens when corporate makes a lot of decisions that affect patient care and that makes it unsafe.
This group of leaders decided that they could fight for legislation that would put a limit on the number of patients a nurse cares for at one time.
Through the union and having the expertise of our legislative and regulatory staff, we drafted the strongest safe staffing ratio law in the nation.
This kicked off the revolution in California for safe patient care.
We collected the stories, and everybody had a story to tell about a very scary incident that they had, whether it was themselves or a loved ones. And we went into the state capitol and we told those stories to the legislature. The hospitals were there with their hundreds of lobbyists.
They're using their strength and power, and so we decided to do the same.
Nurses in California fought day and night for over a year.
We made district visits. We wrote letters to the editors. We did petitions. We organized.
They were present at every rally, every protest. They marched on the Capitol.
And so all of this came together until we actually got the bill through the legislature on the governor's desk, and it was signed.
And with the fight and the victory in California, our union, representing only direct care nurses, learned a critical lesson.
And the only way that you can overcome the large contributions of these corporate employers is by coming together.
It just really makes a difference when you have somebody to back you up. You can stand up for your patients and know that there are over 100,000 nurses behind you.
And if we want to win this nationally, the only way it will happen is if you get involved, if you organize, secure your right to be a patient advocate, and join the movement for nurse-to-patient ratios.
When we come together and organize, we really have the ability to be powerful in the legislature.
The California safe staffing law has been a resounding success for patients and nurses. The doomsday scenarios that the hospital industry fearmongered about have not come to pass. In a statement on the law released by the CNA, they said, "These seminal safe staffing ratios took effect in all California acute care hospitals on January 1st, 2004. The sky did not fall. Hospitals did not close en masse as a result of needing to comply with the safe staffing laws. Patients were not turned away from emergency departments. But what did happen is that nursing in California became a much more rewarding profession again. RNs within the state not only returned to the bedside, but the California ratios attracted nurses from across the country who appreciated being able to practice nursing under a safe working environment and actually get to spend time with their patients. Nurse recruitment and retention has improved, saving hospitals from the expense and clinical disruption of rapid turnover among nursing staff." And like I mentioned before, increasingly safe staffing legislation is being introduced in state legislatures across the country, and usually nurses' unions are leading the effort. The left should rally around this legislation and form coalitions with nurses' unions to fight for it. Left candidates should make this a core part of their platform, and left electeds should be out front as the main champions of it. And this issue isn't going away and has become a core part of almost every nurses' union contract fight. Saint Vincent nurses have been on strike for 8 months, and safe staffing is a main priority.
What do we want? Safe staffing. When do we want it? Now.
Loud voices stand in solidarity with one clear message.
Safe staffing! Safe staffing!
Instead of taking care of patients, nurses at Saint Vincent Hospital in Worcester are taking to the streets. On Monday, hundreds of nurses went on strike to push back against what they're calling unsafe staffing conditions. Marlena Pellegrino has been a registered nurse for 34 years.
We're having a staffing crisis in that building where we have too few bedside nurses able to take care of our patients.
The nurses are represented by the Massachusetts Nurses Association. The union says in the last year alone, nurses have filed more than 600 complaints about staffing.
I've been at this hospital for 13 years as an emergency room nurse, and we've seen no increase in staffing in that time.
They say it's become so critical it's jeopardizing the safety of patients.
People's lives are in danger every day.
St. Vincent's Hospital CEO Caroline Jackson.
It's very disappointing that they chose to walk out and go on strike today, given that we are still in the middle of a global pandemic. We feel the offer we have on the table for them is very fair and has appropriate staffing.
We're not going to go back into that building unless there is safe staffing in our contract.
Nurses say it's the last thing they want to do, but they're out of options.
I want to be at the bedside. I want to be with my patients.
And this issue is a little bit personal for me. The first political campaign I ever got involved in was a nurses' strike back in 2010, where I got involved in building student support for the workers. I became more invested in that strike when I heard from a nurse what the campaign was really about. It was about more than their wages or their benefits. I was moved when they described how the pressure to take on more patients literally put lives in danger. It also made a light bulb go off for me into how powerful the labor movement could be. That the labor movement is a place where we can fight for the interests of all people, not just the particular members of a given union. And safe staffing is a great example of bargaining for the common good, a strategy that I've mentioned on this show before. Bargaining for the common good is the idea of unions bargaining for things that benefit the broader community as well as their own members. And this approach is not just the morally right thing to do, it's strategically sound as well. Having the support of the broader community can be the difference between a union winning a strike and losing. And it's a way of making a connection between unions and mostly non union working class. It also helps to preempt the anti union talking points from management. We know they're always going to try and paint striking workers as selfish and privileged in comparison to other workers. But it's hard for people to really believe that when they see that the nurses union is putting the concerns of patients front and center. And the issues over safe staffing are one of the most clear-cut examples of what happens when healthcare, and specifically hospitals, are run for profit instead of human need. Hospitals are doing the same kind of cost-cutting and lean production methods that we see in almost every other industry in the economy. Simply put, they're trying to squeeze more work out of less workers so they can increase their profit margins. And the fight for safe staffing at its core is about taking the profit motive out of healthcare. It's becoming urgent that we do something on this issue. Across the country, nurses are reporting being burned out like they've never had been before. COVID-19 would have put enormous strains on nurses even with good staffing ratios. But the fact that the pandemic has collided with previous existing staffing issues has pushed many healthcare workers to the breaking point. And if we don't improve conditions soon, the future of our healthcare system will be at stake. An article about nurses in Pennsylvania explained concerns about safe staff-to-patient ratios predated the pandemic for nurses in Philadelphia and across the country. But the high-intensity needs of COVID-19 patients have made the crisis worse. And nurses say the relentlessly chaotic conditions are causing career professionals to seek jobs at hospitals with better staffing ratios or leave the field altogether. This is the worst it's ever been in healthcare, says Mary Adamson, who's a nurse at Temple Hospital. I've been in and around hospitals for 30 years, and this is the worst. The next time you drive by a picket line of nurses or see something on the news about another nurses' strike, just realize that they are probably fighting for the right to be able to do the best job that they can do for their patients. And it's time that we pass safe staffing laws in every single state. So, what do you think, Jen?
I don't know if you guys remember this, but if you were watching when we had Max Alvarez on, like I think months ago at this point, we talked about the Saint Vincent nurses strike then, which was already, I believe, in like its 6th month or something at that point. And they're still on strike. So, Paul, when you actually showed that clip of the strike and the CEO of the hospital saying like, well, I can't believe that these nurses went on strike during a pandemic. It's so selfish. I just want to remind everybody that that company, Tenet Healthcare, the ball is in their court, and they actually could have ended the strike 2 months ago, but they chose not to. So there's that. The second thing I want to point out, and we talked about this again when we had Max Alvarez on, is that it's actually really difficult for nurses to go on strike. It's not nothing. It's a really big deal. The obvious reason, of course, is that, when nurses go on, nurses can't just walk out of the emergency room. People will die. That much is true. And they don't want that. They care deeply about their patients. I talked to one of the nurses who actually the woman in the clip you showed, Marlena Pellegrino, she made it really clear that nurses obviously care deeply about their patients. This is not a light undertaking. There's actually even language built into most nursing contracts that they can't go on strike, or there's like a 10-day like grace period where when after they authorize a strike, they're not just going to work out. I mean, there are all of these mechanisms built in because it is so devastating when nurses go on strike. So that's all to say that it is a huge deal. And as you said, they're doing it for the patients. And I think that's really clear. Even with the Kaiser Permanente strike that seems to have been averted today, I believe that one of the provisions that they fought for and that they actually got in the tentative negotiations was better staffing ratios.
Right.
So.
Yeah. And, just to make clear how the hospitals are usually bullshitting when they fake concern over the patients, because of course they'll say the nurses are putting patients' lives in jeopardy from striking. But going back to that strike in 2010 that I was involved in, and actually the woman quoted in that last article, Mary Adamson, is a good friend of mine who was part of that strike. But when they brought in the scabs, in this case, it's a much more dangerous thing because they were bringing in people who were not as skilled as the nurses were, and this is different than it's one thing to bring in workers scabs for the John Deere strike who may
Right.
not know what they're doing, but when you're dealing with nurses, that was a big big risk they were taking.
Hmm.
And as usual in most strikes, we found that they spent more money trying to break the strike than it would have taken to actually just settle the demands. But that's just a danger that exists with them bringing in replacement workers for nurses because it's not exactly something that anyone can just do to be a nurse. So
Mhm. Yeah. Yeah. And again, this is something that we touched on when we had Max Alvarez on again. But I think that the interesting thing about nursing and healthcare as a profession is, on the one hand, you can see that these workers have enormous leverage, right? Like I said, like it is literally a matter of life and death in very many of these cases. Like it's not easy for anybody when nurses go on strike. At the same time, that also makes it that much more difficult for them to go on an open-ended strike. And I don't know. That's something that I think about a lot, I guess.
right.
But I think what you were saying about making safe staffing part of a legislative package is so crucial and really really interesting because because it's so difficult for nurses to go on strike. Like, what if we took that out of the equation?
Right. Yeah, and I think it's interesting for someone who's a legislator to think about because it's both a labor specific kind of bill, but it's also like a broader public
Right, public
interest
health.
bill.
Yeah.
Right. And I think especially, post COVID or I guess mid COVID, whatever we are,
At some
I think
point. Yeah.
whatever we are in the COVID process, I think there'd be something that would appeal to voters or people would really see the importance of. And
Hmm.
maybe one last thing is for people to realize that I think in the last 20 years, nurses have been the fastest unionizing group of workers. And even in Pennsylvania, in my state, we've seen like a rush of nurses organizing in these last 5 to 10 years. And I think they hit a point where for a while it was tough because many nurses were kind of thought on themselves as, we're professionals, we're not
Hmm.
workers, we don't need a union. But conditions on the ground are forcing them to think differently, and they are the fastest group of workers who are organizing unions now.
So, do you think that the pandemic is going to kind of spark more militancy among both unionized and non-unionized nurses? Because it kind of seems to be, right?
Yeah, I mean, it seems like it already has.
Yeah.
And something I've always been wondering is just like even just the rhetoric of essential workers, and it's like be careful what you say. Like people are going to actually start believing that,
Right.
and seeing that it's true. I wonder how much that's playing into what is going on here.
Hmm.
There's a lot of like similar examples. Like obviously, it's a very, very different context, but post World War II, there was a huge strike wave. Again, we all love to talk about general strikes. There were real general strikes in the post World War II strike wave. I think part of it was this sense of like we've sacrificed a lot. There were wage controls during the war, price controls. We sacrifice a lot. There's pent up demand, and now we deserve something. And I wonder, obviously, a very different context. I think to a much smaller degree, but I wonder if that same kind of mindset is happening now among workers.
If you like this video from the Jacobin Show, please hit like and subscribe and share with your friends.